I'm happy to be here and share with you guys the findings from research we conducted earlier this summer on behalf of the foundations. What I'm going to walk through in the next 13-15 minutes is our overall research approach, what our objectives were, the key findings from both our secondary and primary research, share with you some of those key observations, takeaways that I had as a moderator and leading the research, go over some outstanding questions uninsured have about the marketplace and the Affordable Care Act, and then we should have about 5 minutes or so at the end for questions. So we started out with some secondary research to really gain a better understanding of who the uninsured are in Missouri. There's a lot of research out there about the uninsured. We wanted to see, are there reports out there that have already kind of identified what's unique about the uninsured in Missouri? So we wanted to create a demographic profile. We wanted to better understand uninsured Missourians' media habits and their health attitudes, and then also see, are there subsegments within the uninsured that we also need to pay particular attention to. We used that secondary research to then inform the primary research, which we did via focus groups this summer, that really allowed us to have some in-depth discussions with uninsured Missourians across the state to better understand their awareness and perceptions of the Affordable Care Act, what's going to motivate them to actually go to the marketplace and purchase health insurance versus what are the barriers, the types of communications materials that really resonate with them so we can identify those messages that we need to get out to people, and then also the type of communications channels that are going to be most effective for reaching the uninsured. So I'll briefly go through some of the key findings from our secondary research, and what this involved is really just going through any publicly available existing research that had been conducted about the uninsured here in Missouri, but also nationally. There have been a lot of national segmentation studies already conducted, so we took a look at all of those existing studies. We pulled data from the U.S. Census website. We also have access to what's called the Simmons database. Experian does an annual household survey of all U.S., not all U.S. households, of a representative sample of U.S. households that asks consumers questions all the way down to what magazines do you purchase, what type of car did you buy in the last 6 months. They also ask about insurance status. So we were able to look at uninsured Missourians through this database and pull out some nuggets about how they consume media and what some of their attitudes are towards health. So through all of that, we were able to create a demographic profile of the uninsured here in Missouri. I think a lot of people here probably have seen a lot of these statistics before, but over the last 12 years, the rate of uninsured in Missouri has increased significantly. Currently, about 17% of Missouri adults do not have health insurance coverage. A small majority, 51% of uninsured in Missouri, are from working families. So these aren't always people that don't have any kind of income. They're either working hourly jobs, part-time jobs, that just are not providing them health care coverage. You know, they tend to be Caucasian, but that's not surprising given the state tends to be white. But when you look at the rate of uninsured within different demographic groups, that African Americans and Hispanic have higher rates of uninsured adults, which is important to know from a communication standpoint. They also tend to be lower income and have a high school education. And some national studies pointed to the fact that while we know the majority number-wise of uninsured in Missouri live in the urban areas, when we compare the uninsured in Missouri to other states, we have a higher proportion of uninsured in rural areas compared to other states. So definitely needs to focus on both the urban and rural perspective from a communication standpoint. So that Simmons database I mentioned gave us some really interesting nuggets of information about their attitudes. This first data point isn't that shocking. The uninsured they avoid going to the doctors and having regular checkups. If they don't have health insurance, they're probably not going in for an annual exam. But what I think is more telling is that they are statistically more likely than the general Missourian population to take medication at the first sign of pain or not feeling well, which means they're trying to self-medicate. So if they have a headache or a weird pain, they're going to take ibuprofen. They're going to kind of wait it out and really weigh, the cost benefit of, well, if I go to a clinic, I'm going to pay $300 out of pocket. Can I just wait this out? They're also, which is really interesting, more likely to seek information from libraries. People kind of forget about libraries as a community center, but the uninsured in Missouri they do over-index with libraries as an information source. They also are talking about health issues with their friends and family, indicating that word of mouth is going to be important. So while they do use word of mouth and some traditional sources like the libraries, they are active online. So we can't overlook the online factor. They are active in social media, particularly on YouTube and Twitter. So when we looked at all this research and also some of the national segments, we were able to identify 3 subsegments of the uninsured in Missouri. The first group is lower income women or just female heads of household. There's a lot of research that shows that women are the ones who tend to make the healthcare related decisions. They're the ones who are going to make an insurance decision. They're the ones going to purchase the medication, make appointments with doctors, things like that. From the research we saw, this lower income group of women, they see the value of health insurance. They want health insurance to protect their family, but they are very concerned they can't cost it. They're weighing a lot of other things. They have to fit within their budget, and health insurance is just a lower priority. The next group is what we call the healthy and young. Other terms used are the young invincibles, so that's that 19 to 29-year-old group. They're healthy. When they think of health, they think of being fit, so what they eat and work out. They're not concerned about going to the doctor. So this is a much harder group to sell on the need for health insurance just because they don't see the benefit right now at this point in their life. The third group we identified are those that are concerned about health, or another term we've seen used are the near retirees, so people 40s, 50s, not old enough for Medicare, maybe had health insurance through a previous employer for most of their life, find themselves without it now. They may have a pre-existing condition or now find themselves as caregivers for aging parents. So a highly motivated audience. They've probably had health insurance in the past, they want it again, and their biggest concern again is cost. So after that secondary, all that secondary analysis, we moved into our primary research phase. And to do this, we conducted 9 2-hour focus groups with over 80 uninsured Missourians across the state. And as you can see, we talked to each of those 3 segments, but we also added a group of what we labeled as high poverty. So these were people that do not qualify for Medicaid, but they're also not going to qualify for financial assistance through the marketplace. So given that we have this group of people that are going to fall through the cracks, we wanted to make sure, is there anything from a communication standpoint that we need to do differently for them? Are there other resources we need to talk about? But we went to both urban and rural locations, and within that female head of household group, we did do one group with just African American women and one group just with Hispanic women to make sure we weren't missing anything from a cultural standpoint in our communications. The way the focus groups were structured, we spent the first hour just really exploring their attitudes and perceptions of healthcare and the Affordable Care Act. So even though these people or these participants do not have health insurance, healthcare and health is just a topic they are interested in, they're concerned about. They're talking about it with their friends and family. They're most concerned about affordability. A lot of people said, look, if I had money, I'd already have health insurance. This is something I think is important, and I'm concerned that I can't afford it. I'm concerned about the cost of prescription medication when I do need something. And they also have fear about what could happen to them if something catastrophic were to happen to them, being faced with a $50,000, $60,000 medical bill that they're then spending the next 10 years trying to pay off. Quality was also a concern that came up over and over again in the focus groups. From their standpoint, they feel like people without insurance, if they show up to a clinic or an ER, they are pushed through quickly. They're not really treated. They're given kind of medication and sent on their way, where they feel like if they had health insurance, they would get to talk to a doctor and really kind of diagnose the underlying issue instead of just having their symptoms treated. So while healthcare is a topic that they are paying attention to, they know very little about the Affordable Care Act. When we said, I think the question I threw out at every group was, so a law passed in 2010 about health care. Can anyone tell me the name of that law? And everyone kind of said, are we talking about Obamacare? And I said, yes, but can anyone tell me the actual name? And no one really knew. A few people knew Affordable Care Act, but that was definitely in the minority. So while they've heard of Obamacare, when you probe them and say, well, what's the purpose of the law? What do you think its impact is going to be on Missourians? People kind of, all they could articulate was, I think it's universal coverage for everyone. I think it's supposed to make it more affordable. I don't really know how it works or what it's actually going to look like. They also were very skeptical that the health insurance offered through the act would be affordable to them. So they said, well, it's great you're going to offer it, but you're making me pay for it, and I probably still won't be able to afford it. So because of that, they think the impact of the Affordable Care Act is going to be negative on them. They also, most people had never heard of the marketplace, and so we even gave them a brief description of the marketplace just to kind of see, does this make sense? What do you think about this idea where you can go and shop for insurance plans, compare, and find one that fits your budget? Even with the description, people were kind of confused about the purpose. They thought, am I going to go into a building and there are going to be all these insurance companies and I can walk around and talk to them? Is it going to be a Walmart of insurance companies? And once they understood that it was a website, people, they liked it, but they did have concerns about not being able to pick up the phone and talk to someone. And within that description of the marketplace, we also gave them information about the financial assistance that will be available, which people did respond positively to. It was something new. Most people did not know that would be available. They liked that it was based on a sliding scale. However, when you ask them, well, do you understand what we mean by tax credit? Do you understand what we mean by a subsidy? People were not really able to articulate what that means. So they liked that that option's there, but they had a lot of questions about what that's actually going to mean to them. So we said to them, setting aside this is the law, it is mandatory, what's going to motivate you to go to the marketplace and purchase health insurance before January? And the number one motivator is also the biggest barrier. It's cost and affordability. People want to go in and see if they can really find a plan that's going to fit their budget. Something else that came through loud and clear is the ease of the process. It's either going to be a motivator or a deterrent. A lot of these people told stories about applying for Medicaid or SNAP benefits or other government benefits, and they felt like it was a very cumbersome process where they gathered all this paperwork, showed up, and they forgot something and had to go back and get something else. So they felt like if I can go to this marketplace or this website and it's really easy and I can figure it out, that's going to motivate me to kind of explore more and learn more. And building on that, if they can understand it, so the importance of using really simple language. We spent the second half of the focus groups looking at some communications materials to identify the types of messages and words and phrases that are going to resonate with the uninsured. So to do this, we had them look at 4 existing websites. We looked at Colorado's, Oregon's, California, and Hawaii's. And the reason we had them look at these websites was just to figure out when you go to Missouri's website, what do you want to see? What are you going to click on first? What's most important to you? We also had them look at 3 brochure covers, and the reason we just did covers is we wanted to know when they're at their children's school or the library or anywhere where there are all these pamphlets, how is ours going to stand out and motivate them to actually pick ours up. And finally, they evaluated a flyer, and the purpose of this flyer was really just to give them all the information about the Act, the marketplace, and the financial assistance, and really kind of understand those words and phrases that are resonating with people and any words or phrases that people just aren't understanding, so we could find a way to make it easier for people to understand. So while we can't talk about everything we heard about all those things, luckily a number of themes emerged from all those discussions. When we are reaching out to the uninsured, people want to feel welcome. They want it to feel friendly. So health insurance is very complicated to begin with, and we're talking to people who don't have it and maybe have been told in the past you don't qualify for health insurance, you have a pre-existing condition. So they're coming in with a very negative perception. So when they looked at the Hawaii website or the California website, which use these white layout, blue colors, people said it felt very welcoming. Like I feel like I can come here and find something for me, that I'm finally included in the process. Building on that, they also wanted the language to be very simple and clear. Again, that made them feel more comfortable and made them feel confident that they could make a smart decision. Images are also extremely important. Not only do they want the image to actually communicate health, so they don't want to just see smiling faces, they want to see something that tells them this is about healthcare, health insurance, but on the other end, they don't want to see people lying in a hospital bed and sick. So it's this balance of communicating the positive benefits of health insurance. And also a diversity in images. They want to see not only white people and Hispanic people, they want to see older people, younger people, and they want to see single people. One of the brochures we tested had a picture of a mom and a child, and while people with families loved it, there were a lot of people that said, I don't see myself in that, this tells me it's a program just for families. So just the importance of making sure everyone knows that the marketplace is for everyone. The cost calculator was the big one with the websites. People said that is the first place I'm going to go on the website. It needs to be front and center. That's my biggest question. I need to be able to find that easily on the website. On the flip side, the things that turned people off, if the design felt cluttered, it made them feel overwhelmed. Again, they want to feel calm and confident that they're going to be able to find the information that they need. So in reaching the uninsured with information about the marketplace, the Affordable Care Act, they listed a number of credible information sources. Government agencies, both federal and state, are viewed as credible. They don't think the government is going to try to push them towards an insurance plan, whereas they would feel like if an insurance company is promoting it, that there's some kind of ulterior motive there, that they're trying to make money off of them. But a lot of this is word of mouth. They mentioned churches, community organizations, employment centers, and just friends and family. And through the channels they volunteered, it's really everything. They said social media, email, but I want to be able to come talk to someone in person at a town hall or a community meeting, put something in my mailbox. And this, we just wanted to share some overall kind of key takeaways we had when we wrapped up all the focus groups. So again, lots of confusion and skepticism about the law, about the marketplace, about the financial assistance that our communications needs to address. And something that was just kind of interesting from my point of view that I hadn't expected coming in is people were tying the marketplace to an entitlement program where they felt like if they go to the marketplace, they're going to get an Obamacare card, and they're going to walk in and get treated differently versus walking in with a Cigna card or Blue Cross Blue Shield card. So just the importance of really helping people understand we're giving you access to private health insurance. And questions that came up through the focus groups that we have used as we inform the materials, a lot of people had questions about, well, what happens if I don't get health insurance? Are you going to throw me in jail? Are you going to put a lien on my home? What's the actual penalty? They want to know about who the providers are, the quality of the plans. Are they going to be able to purchase the same plans that people get from their employers? They also had a lot of questions about pre-existing conditions. We had one woman that said she's been denied over and over again because of pre-existing, and that wasn't going away, and so that message hasn't gotten out there. And this last one, again, something I take for granted as somebody who just re-enrolls in my insurance plan every year. The whole idea of an enrollment period was very confusing to people. Some of the language they read, they thought it meant you enroll in October, you start paying in October, but you don't get the benefit till December. So that was just another area of confusion they had that we're trying to address through the materials. Are we on time? Oh, I got extra minutes. Okay. So questions. Sorry, I know I went fast.
When you talk about helping young 19 to 29-year-olds, isn't that where the catastrophic plan is going to come in? I haven't had anybody talk about that yet today.
And I'm probably not the best person to answer the specifics about the plans, but I know just from what I've read through other news stories is that's what I would know too. We didn't, in the focus groups, we did not get into the types of plans or the type of coverage. Our goal was to figure out what's going to motivate them to learn more and what type of terms really resonate. But I think the Young Invincible group is here, so they may be able to answer that more so than I could.
According to the Navigator training manual, it's one of the types of plans that are available.
That's right.
For under 30. I don't know if that helps you, but that's...
Well, yes, that is what people talk about, not wanting insurance when they're in that invincible age. That was the whole purpose of the catastrophic, was to get those people at a very cheap level, cheap premium, to be able to register to help the pool grow.
Right. Supposedly you get preventative care out of it, and that's pretty much it.
Or if yes, you have a catastrophe where you end up in the emergency room in a terrible motorcycle accident. And then you would have care.
How difficult, this might not be a fair question for you, but noticing the responses you got and what I hear from talking to people, how difficult do you think it's going to be to move large numbers of people to understand that when you go on the exchange, you are indeed buying private insurance. You're not going into a government plan, you're not, you're not getting an Obamacare card or whatever. I mean, when you were with these focus groups, what did it take for them to understand exactly what the marketplace was?
It generally just took a credible source like myself giving them the answer. So the way we designed the groups, I moderated almost all of them, and I said, I'm not an expert on the Affordable Care Act. You guys are going to have questions. I'm here to hear those questions so we can address those through communication. So I didn't jump in every time they had a question, but if it was something where you could tell it was really impacting their perception and it was going to impact the feedback, we kind of had to jump in and say, no, the enrollment period means this. And usually if it was me, or even if usually someone from the foundation was with us, if they came in and verified a fact, that was usually enough. So I think the bigger challenge is just all the other people talking about it and kind of making sure they're getting information from the credible sources.
Well, I mean, I think you're probably right about that. In the groups that I've talked to, what they really want to know is they just want to know what the facts are. But those are pretty broad belief sort of things. How do we know we're even talking to these people or have an opportunity to talk to them? That's maybe the bigger challenge.
And that is beyond my expertise, but no, that's a great question.
Still, with the very low income people that don't qualify, like for Medicaid benefits now, that how do you get over that too because it is going to cost them to get them to understand that they've got to sign up for something. I know
if they qualify for Medicaid.
Well, no, these people don't qualify.
But if they're under, if they don't qualify for a tax credit, they're under 100%. they qualify for a hardship exemption, so they won't be penalized for not taking
And they
insurance.
won't have insurance either.
Their most viable option is catastrophic. They qualify under the hardship exemption for so they could purchase a catastrophic plan.
But it's still going to be a cost,
Yes.
and that's the problem, it's still gonna be a cost, I mean,
Mhm.
and I
But
don't.
no cost if they decide not to have no insurance.
Right, and that's I actually think
Mhm.
that's what we're still gonna run into,
Yeah.
is
Mm-hmm.
that we're gonna choose.
Is there a penalty, I think hospitals have to treat, but let's say this is a person who could have health insurance, elects not to have health insurance, and then they go to the hospital. I mean, is there a penalty for them, where they still treat them, if it's not
You have to treat
emergency,
them.
if it's not,
You have to treat them.
emergency, if it's emergency, they have to treat.
You have to treat them,
Okay.
Go to the emergency room.
so you have to at least triage them.
They might not be treated. They're just treated, their symptoms are treated.
Yeah, you have to treat them.
And if you get admitted and you end up with cancer, then you'll be treated also. Once they get into the system, they are treated as if they had insurance. There's no distinction made. Is the way it's supposed to work, but I guess maybe
Yeah.
that's not your experience.
Well, it might not be either.
You don't think that's the way it's supposed to work?
No, I think it's the way it's supposed to work. I'm not so sure that you get as good as care if you come in with insurance versus.
That's why I said that may not be your experience.
I think that's also different between rural and urban.
And it may depend on the hospital.
Yeah, that probably has
The
something to
amount
do
of
with it too.
money
I
they
mean,
get.
we don't even, where I work, I mean, we're admitting homeless people. I mean, they actually don't even have an address.
Mm-hmm.
The same as we admit somebody with, we don't even check their benefits. I mean, they come in the emergency room, it doesn't, I'm not going to say that you couldn't come there and have the best benefit available and be treated badly. I'm not gonna say that couldn't happen, but we also have somebody that comes in homeless, and they're just as likely to be treated,
Mm-hmm.
tremendously as but
That's the way it's supposed to
that's the way it's supposed to be. Does it happen that way all the time? No.
But I think that equal benefit is through stabilization. I don't think there's any legal requirement for cancer treatment over a period of time. That would be subject to the specialist in the chemo facility,
Well,
whether
my
they care to provide
experience
that
as
or
a
not.
parish nurse, when that happens and you get in there and then you have no insurance, the social worker gets involved, and before you know it, the family is doing this and that and this and that, and they try to figure out a way where they are eligible for some program. And that access to the social worker and their creative skills does make it possible for the person to be treated ongoing.
But
I think there is speculation that
Good social
hospitals will
workers.
change their charity care policies because of the availability of insurance. So, if someone has access to insurance and is just making a choice not to sign up for it, you may see hospitals change their policies. There's speculation about that.
And our research didn't get into that at all, but
Did any of the people ask you was the insurance gonna be free? Did they have something that would be free insurance?
there were maybe a few people, but most people knew there would be some kind of cost associated with it. They just didn't know what that meant. And when you kind of say, well, what does affordability mean? To some people, they thought $20 a month would be affordable versus, $100. So it was kind of hard. Everyone acknowledged that affordable is going to mean something different to everyone else. And they wanted to know, well, what's it going to take into account? Does it matter that I have kids, that I have a car payment? What all goes into that, whether or not they qualify for the financial
Any
assistance.
concern with cost sharing aspect at all?
We didn't get into that many details with these guys.
What was the overall mood of the people that you were interviewing towards this?
They were more negative than I think walked in thinking they would be. Yeah, I think they were very skeptical. They didn't like that it was mandated. A lot of people, especially in the rural markets we went to, really were hung up on you're forcing me to do this, and now I can't even afford it. So there was some, I wouldn't say anger, but there was just a lot of, no, I guess anger. Yeah, so they were frustrated, and I mean, they were just, yeah.
Exactly what I'm thinking
But as they read more,
and they're gonna look at it as, like, we're supposed to know all the answers when we're just guiding them in, you need to check one, for yourself. That's my kind of thing that I'm worried about, the overall for the ones that are going out in the field.
Yeah, I will say though.
What we're gonna be facing with people.
Right. I will say that just in the 2 hours we were with them, and as we kind of walked them through and gave them more information, they started to feel better about it. Now, they still had questions about, can I actually afford it? I mean, we had, especially in that health concerns, the older group, several people walked out and said, I can't wait for this. I'm signing up, and I'm going to take every thing offered to me. I'm going to every doctor. So there's definitely groups in it, especially that older group that really wants the insurance and are going to take advantage of it. And as more of their questions were answered, they felt better that it might be affordable, but it's a lot of wait, until they see the plans in there. I think a lot of people can't make a decision about it. But everyone left thinking, well, why can't everyone come to a 2-hour focus group and learn? We can't bring everyone to a focus group's the challenge. But so I think that's what's promising about the campaign and the website is once people have the information, they felt better about it. They still didn't like that it was being forced upon them, but at least they were more open to it, I would say.
The price calculator seems to be very helpful when you're sitting down and walking through someone, because as soon as they see the price, it's not as near as much as they anticipate that it was going to be. In some cases, it doesn't cost them anything.
Right.
Or very, very, $20 a month. And they're like, oh, this ain't such a bad thing.
Right, right.
Jan, I've done this 10 times today already, and this has definitely been the most lively discussion
Yeah.
we've had so far, so I really hate to cut it off, but we've got a schedule to keep, and
That's right.
making
Thank
sure
you.
that we're on